Hi everyone, it's Silvera for Senior. Today we're going to be going over a heart health video because it's February, and as you guys know, February is all about heart health. So we'll be talking about some general facts about heart health and all the things related to the heart. In today's agenda, we'll be introducing ourselves as pharmacy students, and then next we'll be talking about some general health info about the heart and some facts about the heart. Next after that, we'll have a few fun comics for you guys to view and a 2-minute educational video that will kind of outline why it's important to exercise and how it affects your heart in general. Next, we'll quickly outline what hypertension means and what to watch out for when it comes to stroke signs. And then a bingo sheet will be available to you if you would like to participate, as well as some trivia questions that will test your knowledge on heart health. And then finally, we'll have some suggestions for activities in the Calgary area if you ever decide to go on a spring walk. So to introduce ourselves, my name is Dalton, and Lindsay will introduce herself in a bit, but we're both second-year pharmacy students at the University of British Columbia, also known as UBC. And like I mentioned, we'll just be going over heart health, heart facts, and just general tips for all of you in this video.
Hi everyone, my name is Lindsay. I'm also here presenting with Dalton, and so we're going to start right at the very basics. And what is heart disease? So heart disease is a big umbrella term, and it encompasses all the other heart conditions like heart attacks, angina, atrial fibrillation, heart failure, and other ones. In general, heart disease means that there's less blood flow getting to your heart, and then your heart isn't getting the oxygen it needs, which can cause other diseases and conditions. Heart disease is also known as coronary artery disease or ischemic heart disease. You guys might have heard all those terms. They all kind of mean the same thing, various different heart conditions. So why is heart disease important? In Canada, heart disease is the second leading cause of death. 2.4 million Canadian adults are living with heart disease, which is roughly 1 in 12 Canadians. Heart disease also affects men and women differently. Men are twice as likely to have a heart attack compared to women, or tend to be newly diagnosed with heart disease 10 years younger than women. But it's not all bad news. Some good things about Canada is that they actually noticed that the death rate of individuals with heart disease decreased from 2000 to 2013 by 23%. That trend is still continuing, but we couldn't find newer stats than the 2000 to 2013 one. We know that you guys have probably all heard the basics, that eating healthy, doing exercise, it's all good for your heart. So we wanted to give you some better info, specific tips that you can do to make your heart healthier. A good one is just to talk to your doctor about cholesterol levels and blood pressure. Cholesterol is measured usually with your yearly blood test, and then your doctor can take your blood pressure, or you might have a blood pressure machine, or many pharmacies also have blood pressure machines, and a pharmacist can show you how to use it. So cholesterol and blood pressure are good measures that show if your heart is receiving a good blood supply and not working too hard. So it's good to kind of figure out like what good numbers mean, what kind of numbers you should be aiming for. Taking care of other conditions you might have will also keep your heart healthy. So conditions like diabetes, high blood pressure, kidney disease, if you like control your blood sugars better with diabetes, that's also going to help your heart health. An easy way to help your blood pressure is to cut back on the salt you eat. Some good ways to cut back on salt is to buy reduced sodium or salt products, and those are often designated with a light blue label. That's how you can tell that they're the low sodium ones. You can buy unsalted butter and nuts. Sometimes people will buy like 1 bag of salted nuts and 1 bag of unsalted nuts, and if you mix them together, it's like semi-salted. It still tastes pretty good, but it's not as salty. Another thing you can do is rinse canned goods before you add them to your meal. So if you just like dump them in a strainer and rinse them with water, that gets rid of all like the salt and solution that was also sitting in the can. It's better to buy fresh bread from the bakery section of the grocery store. Another good thing you can do is eat more fiber. So fiber helps lower your cholesterol levels, because what it does is it binds to cholesterol in your gut, and then your body doesn't absorb cholesterol as well. So some sources of food that are rich in fiber are apples, pears, oranges, strawberries, potatoes, oats, seeds, all bran cereal, and Special K. And then finally, I'm going to talk to you guys about remembering to take your medications as prescribed. As a pharmacy student, I wouldn't be doing my due diligence if I didn't tell you guys about this. So in 2015, about 30% of Canadians stopped taking a medication before they were advised to. And it's important to not stop taking a medication because a lot of diseases are silent, which means you don't feel sick despite having the disease. Like you'll notice if you have high blood pressure or diabetes, you often don't have any symptoms. You'll feel totally fine and healthy. So it's hard to keep taking a medication that doesn't seem to have any effect, but it's really important to try and remember the long-term benefits, that even if you feel the same, it's better to take your medications, just because in the long term, that's going to help prevent, heart attacks or your blood pressure getting worse and things like that.
Thanks, Lindsay. So now we're gonna just take a little break and go through some comics just to bring up the mood a little bit. If you see some of these comics, they're just kind of some lighthearted comics about blood pressure and heart health in general. This one, the first one here, is joking about how if blood pressure is 180/90, fraction that to a 2/1 doesn't seem that high. The other ones here are just kind of talking about there used to be no vending machines back in this guy's old day, but nowadays at school there seems to be a lot of access to salty snacks and sweets. As you guys can tell here in the third one, the brain is asking what happened to the heart, and the heart seems to be in distress because other things that are happening in the world. So a lot of stress on the heart. Next slide of comics here, just a little few more fun comics that you guys can just read. I'll give you a few moments to look at them. Top right corner, talking about how lady's talking to the guy about him promising that he'll take better care of himself, but he's saying that he just took his vitamin. So even though he took his vitamin, he's still eating unhealthy. He's eating Twinkies and drinking it with a Coke. So it kind of goes back to what Lindsay was saying about healthy diets and trying to cut down on salt if you can and incorporating more fiber into your food. So just because you take a vitamin doesn't mean that it's gonna magically help with your heart health, and I think many of you should know that. After showing you some of these comics, we're gonna play a quick 2-minute video. And this video will just highlight the importance of exercise and how exercise can affect your heart and how it will lead to a healthier and stronger heart. So I hope this video will be educational for those of you watching, and I hope you enjoy the video.
Remember the last time you climbed a flight of stairs? Did you feel your pulse speed up and your face get warm? That's because of changes that happen in your heart during physical activity. Your heart's job is to move blood around your body, blood that contains oxygen which your muscles need to work. When you exercise, your muscles work harder and need more oxygen than when at rest. To deliver this oxygen, your heart starts to beat faster, which is why you feel your pulse speed up. When you exercise regularly, your heart gets used to moving more blood through your body. The left ventricle, the part of your heart that pumps out blood, make it bigger and stronger. And with each heartbeat pumping more blood, your heart has to beat less often to do the same job. This means both your heart rate during exercise and your resting heart rate will decrease. Regular exercise, in addition to a healthy diet and not smoking, can help prevent the buildup of plaques in your arteries, reducing your risk of heart disease, heart attack, and stroke. Frequent exercise also causes new blood vessels to grow in your body, improving circulation and overall health, not to mention helping you lose weight and look and feel better. While chronic inactivity can lead to weight gain, high blood pressure, and cardiovascular disease. The Centers for Disease Control and Prevention recommends that adults get at least 150 minutes of exercise per week. Any length or intensity of activity is healthier than no activity at all. So start at your own pace. Try taking a few short walks a day or climbing a few flights of stairs and notice as your heart gets healthier.
Okay, so let's talk about high blood pressure. Your doctor might use the term hypertension, that's the medical term, means the same thing as high blood pressure. So in general, an ideal blood pressure target is 120/80, but that doesn't always apply to everyone. Sometimes with certain medical conditions, like maybe diabetes, the blood pressure target can be a little bit different. So it's a good idea to talk to your doctor and see what blood pressure target is best for you. But in general, they're around there. So you guys can just know that 120/80 is a good general number if you take your blood pressure and you're wondering what you should compare it to.
And then next here we have stroke. It's important to have a healthy heart because, as you've seen in the video, with arteries that are clogged up with cholesterol and plaque, you might be at higher risk of experiencing a stroke. Being heart healthy is really important, not only for both your heart and prevention for heart attacks, but also strokes as well. So strokes occur when the brain doesn't get enough oxygen. And that's because the arteries in your body isn't able to deliver that oxygen because of maybe some heart conditions that you might have. So that's why it's important to, take good care of your heart. Your brain, if it doesn't get enough oxygen, then it can lead to strokes. The 4 signs that typically we want to watch out for when someone is experiencing a stroke it's called FAST, and that stands for face. So you want to see if the person's able to smile. If one side seems to be drooping or they're unable to smile on one side, that can be an indicator of a stroke. Arms, ask if they can raise both arms. Usually stroke will manifest on one side of the body. So if it's affecting either the right or left side, then people will have difficulty lifting up either side of the arms. And in speech, you want to see if they're able to speak coherently and clearly. If you find that it's hard to understand them or their speech is slurred, then that could be a sign of a stroke. And then time is call 911 as soon as you see the first sign of a stroke, because treatment for stroke is the most efficient when you get the person to the hospital right away. The medical team can attend to any stroke symptoms as soon as they can. The longer you wait, the more damage to the brain can occur because of the lack of oxygen in the brain. So that's why it's super important to seek medical attention if you see these signs in anyone that might be experiencing a stroke. So going on to this next slide here, we have this active week bingo, and we've also sent a copy of this bingo to Leanne, who would be able to distribute this to you if needed. And basically it's just an active living bingo. It's kind of mixed and matched with all types of healthy activities that you can do, such as making sure that you drink lots of water or getting your physical activity for the day, all the way to eating healthy foods and even taking a nap and taking a break from technology as well. So if you ever find yourself wanting to play some bingo, this could be a good way to incorporate some heart healthy habits into your daily activities.
Okay, so I think Dalton might have mentioned at the very beginning that we had some trivia coming up later on. So we've got a good bit of information out now, so we'd like you guys to take maybe 10 minutes or so to just pause and go through these trivia questions. I'm not sure what the easiest way would be to do it. Maybe your guys' active aging assistant can just hand out a blank piece of paper or something and you guys can quickly go through these. But yeah, you guys can just pause right now, and then when you're ready, unpause the video and we'll have the answer key on the next slide. Alright guys, so I hope you enjoyed the trivia. This is our answer key, and maybe you guys might want to also pause here so you can just quickly go through that. But then when you're ready, we will continue on. We've got some information about high blood pressure and strokes coming up. So next, we also wanted to bring up exercise a little bit, and we wanted to think of some specific things that you can do to get active in Calgary. So we looked online and we found some really nice walks outside, really scenic ones with Calgary's like Elbow River and Bow River, and we listed a bunch of them here. Most of them are around like 5 kilometers, but you also don't have to do the whole walk. We'll list a link later on too that has like a lot of walks. I think it lists 25, and some of them are longer too, like 10, 12 kilometers. And you don't have to do the whole walk, obviously, just turn around when you've done enough. So that was a lot of information to digest. We know that we've given you tons of facts, tons of stuff about hypertension, stroke, what you can do in Calgary. You might not remember it all, which is understandable. So we've just got a slide here with some references on it, and we've just attached website links. So for example, the part that says in Calgary, that lists a bunch of walks all around Calgary that you can go on. The videos here, they're just general, they're heart tips. There's one on nutrition, and I think there's one on exercise. So you can just hit those and it'll take you right to YouTube. We have a section about museums, a link here with the Calgary Herald. They do a really good job at summarizing all of the museums in Calgary. It lists the museum and it gives their contact information, and then it usually has a small summary about what you might see in the museum. I thought it was a really good website. And then last, we just also listed the Canadian Heart and Stroke Foundation. The link here takes you to a main page, and then you can click on anything on that page, whatever you want to learn about. So if you guys have email maybe or devices of your own, I think the active aging assistant could maybe send this to you guys in an email. We're not 100% sure, but we're going to have the links in the video here just in case we can get those to you guys later.
And that's the end of our video here. So we hope you guys enjoyed this video, that you were able to learn a little bit more about heart health. If you ever have any questions, you can always refer to the references that we posted.
Thanks so much for listening, guys. This was personally the first time I've ever created a video like this, and Dalton was super good with the technology, but we had a good time making it for you guys. So we hope you enjoyed.
Yes, and we hope you enjoy the visuals as well.